first keynote. As I mentioned, we are very, very pleased to have Dr. H.V. Ramprakash, sir, who is a very, very well-known senior radiologist from India. He has over 30 years of experience of being a radiologist and the unique combination of being also a thermologist, trained thermologist. So he is trained in not just mammographic imaging, interpretation, ultrasound, MRI, you name it, all the radiological imaging he is an expert in. And in his center, he's been practicing thermal imaging along with several other imaging centers for over 10 years or so. And then now, now he will be calling in from Ghana because he was traveling, and he was kind enough to dial in from his vacation time as well. He is also the director of Center Diagnostic Research Foundation. In fact, I would say he's one of my gurus who actually inducted us to thermal imaging. As you know, at AIIIMA, we have developed a new method of detecting breast cancer, of course, using AI and thermal imaging. And now it's kind of used, in many parts of the world today. And for that, definitely the initial introduction to thermal imaging and thermography itself was definitely through the guidance of Dr. Ramprakash. So we wanted him to give that basics of thermal imaging and how does a doctor see this, and then how AI and thermal imaging is coming together. And again, from a doctor's viewpoint, what is his view of AIIMA? And he was also head of department at Vydehi Hospital, as I briefly mentioned, and really one of the pioneering doctors who was the first one to introduce thermal imaging in India. Of course, it's still, working in very, very small quarters, very few doctors who are able to do it. But he was the first one to bring thermal cameras to India. So without much ado, I invite Dr. Ramprakash sir to come in and deliver his keynote. So
today I'm supposed to talk on the value of AI in thermal imaging. I am a radiologist by profession, and I came into thermal imaging by accident. I was doing mammography, and I found it very difficult to get patients in and convince them to get a mammogram done. That was way back in the 80s. And that's when I switched on to thermal imaging. One of my friends introduced me to thermal imaging, went into US and got a basic orientation on thermal imaging and started my program. To go back into the historical of thermal imaging, the discovery of a thermal camera was made in 1800 by William Herschel. The first infrared camera was built in 1929. But really speaking, the concept of thermal imaging really started with Hippocrates. Can you hear me? Hello?
Yes, sir, we can hear you.
Yes.
Okay. Yes.
Okay. The actual use of thermal imaging started with Hippocrates, and that was the time when they used to spread wet mud over the body to find out the area which dried up very fast, and that they thought was the area that was problematic. Now, thermal imaging, how does it work? Camera barta hai na. Camera, can you see me now? Hello?
Yes, we can see you.
Yes,
Yes, doctor, we can see.
Yes.
Thank you.
Thank you.
Now, thermal
Thank you,
imaging, we are all warm-blooded animals, and heat is produced in our body in the gut, and this heat has got to be radiated out or taken out of the body. Otherwise, we'll begin to melt ourselves with the heat that is being produced. So this is done by a process of conduction and radiation. The skin acts as a radiator, and the blood acts as the conveyor of the heat from the central parts of the body to the periphery. Now, that is how we try to map the heat that is emitting from the body. Now, infrared radiation is of 3 varieties, and we use the range between 7 to 14 nanometers, and that is the range that the body uses to exert heat from the body. Now, various parts of the body can be examined using thermal imaging, but one of the areas which is where it is very useful is in the evaluation of the breast. Why is the breast evaluation so useful, and how does it play a very important role? The theme for this World Cancer Day was artificial intelligence and thermolytics closing the care gap. Now, if we are able to identify the disease much early, we're able to give the patient a complete cure. That is the objective of thermal imaging of the breast. Now, the breast cancer is a disease primarily of the female breast, very rare in males, and it grows within the breast tissue. The breast has got three varieties of tissues. One is the connective tissue, lobules, and the glands. So, cancer can come in any one of these. And amongst all the organs in the body, the breasts are dependent on the hormones that are secreted in the body, the female hormones, and so they are hormone-dependent tumors. There's also a genetic disposition. The genes are also there, BRCA1 and 2, which are also known to be probably involved in the genesis of this tumor. Amongst the breast disease, breast cancer forms about 5% of all the breast disorders. Then 80% are benign. How do we differentiate one from the other? That is the main difficulty with breast tumors and breast disorders. 1 in 8 women in the United States develop cancer, and 1 in 28 women in India are prone to breast cancer. Now, there's a change in breast cancer that's occurring over the period of time. That is 25 years back. It used to be more in the older age groups, as nowadays we see breast cancer occurring in the younger age groups. This is mainly because of social habits and the other things that come through our diet, the hormones that come through our diet. Breast cancer in India, the most common cancer among others, there were about 22,96,840 new cases in breast cancer in the year 2022, and an estimated 98,337 women died of breast cancer, mainly because of lack of awareness and delay in screening and diagnosis. Why breast cancer screening is so very important in saving lives? This is the important question we've got to ask ourselves. We have quite a number of screening methods that are available today, right? Now, these are the statistics that are there as far as the world is concerned, and India plays a very important role. The incidence of breast cancer in India is the third in the world, whereas as far as the number of deaths because of breast cancer is concerned, India comes number 1. That's unfortunate. Now, thermography is useful in all the breast disorders. It's the earliest, it's the easiest, and the best. It can detect a cancer long before the lump is felt. It is non-contact, non-invasive, privacy aware, no radiation, works for all women of all ages, especially the young. It's affordable, it's portable, light and small screening device. Now, the best guidelines for a person who's got a family history is to get in for a thermal image at the age 20 and then to follow it up yearly. Now, this is how it's done. Thermal camera is placed in front of the patient in a cool environment, and the radiation that comes out from the patient is mapped. And on the right hand side, you can see the image that has been created, and you can see the various shades of color. So wherever you have the high red and whites, those are the areas where you have the maximum temperature. All breast ailments can be divided into pain, lump, and discharge. Now the question is, are these usually cancer or are they not cancerous? That's the question. And how do we answer these questions? Now, one of the first diagnostic tools that were available to us was mammography. It was one of the most common methods that came up after the advent of X-rays. mammography started to be used in post-surgical procedures, post-surgical specimens, and then subsequently in the late 70s, we got our first mammography machine. It was dedicated towards the examination of the breast. Now, these X-ray machines work at very low frequencies or very low energy levels, as a result of which the quantum of radiation that's absorbed by the breast increases. So once if you've got to get a picture of the breast, you've got to first take the breast, place it on a pedestal, compress it, and then take the radiogram. Now this is not very comfortable as far as the patient is concerned, and many times, depending on the image that is created, we might have to repeat it quite a number of times to get the proper image. So screening mammography definitely has helped in a big way, but was not enough to give us all the information that we needed. Earlier, mammograms were reduced with the reduction in the breast cancer mortality. At the same time, there were also an increase in the number of breast cancers because of repeated radiation to the breast. So both these things had to be taken care of, and that's where thermal imaging comes into the picture. What are the other examination modes that are available today? We have ultrasound and we have magnetic resonance imaging. And we also have PET scans that are there coming in of recent. These are the other imaging modalities that are useful in evaluating breast cancers. But these are all expensive, very expensive, and not available throughout every place. They're not portable. You've got to go to the place where you have the equipment, and you've got to submit yourself for that examination. Thermography, in a sense, is the best examination, best screening tool that's available today as far as the breast is concerned, because it gives you an indication of the change that's occurring within the breast, right? Now, this tells you the rate at which a breast tumor grows, right? And when thermography becomes positive, that is at around the 5th year itself, thermography becomes positive, whereas mammography becomes positive by the time of the tumor is 8 years old. So that's the difference between thermal imaging and mammography. So in that context, thermal imaging of the breast plays a very important role today as a screening tool, right? Now, why is thermal imaging so important in breast diseases? Breast thermography is useful in all breast disorders. Once you see something going wrong, if you have pain in the breast, should we go in for a mammogram is the question. Or should we go in for other examinations which are less harmful and easily available? So breast cancer being the second most diagnosed cancer in women, right? The objective is to find out whether we've got to proceed with further investigations or not. And that is where thermal imaging plays a very important role. It's based on the fact, thermography is based on one fact, that is the focal raise in temperature of that particular area. If there's a focal raise of more than 2 degrees centigrade, you know that the area is abnormal. Why do you get a focal raise of increase in temperature? Now, whenever you have a cancer, the rate at which the cancerous cells are growing is pretty high. And they also require the nourishment to support their growth. And that is when the blood flow into that particular area increases. As I told you earlier, blood acts as the method by which it dissipates heat also. So the area where there's more activity has more heat. And that is what we try to identify by thermal imaging. Now let's try to understand what thermolytics is all about. Thermolytics is artificial intelligence coming into the period or the place where a radiologist played an important role, or an imaging specialist played an important role. Earlier, the thermogram was done and I had to go through the thermogram and then opine whether it was positive or negative. Whereas today, once an image is obtained, immediately you have the results available to you. And these results are as good as or better than what earlier used to happen. Now, let's try to compare mammography with thermal imaging. Mammography machine costs you between 18 lakhs to 2 crores. Should be housed in a radiation-proof room. Requires electricity for operation. Requires a trained technician. Takes about 30 minutes for examination. Breast compression is required. Requires films or digital storage devices. Post-examination, the film's data needs to be viewed by a specialist. Requires privacy for the patient. Facility not easily transportable. Facility to call back the patient if additional sections are required. Whereas when in thermal camera, with computer and appropriate software, costs about 8 lakhs. Any private enclosure is adequate. An ordinary air conditioner or air cooler is required. Requires a trained technician. An ordinary color printer. Takes 5 minutes for the procedure to be completed. No breast compressing or handling. Report instantly available. No radiation, hence repeatable. Patient can be instructed for further tests if required. These are the advantages we have with thermolytics. Now, tailored supplemental screening for breast cancer. What now and what next? Mammography may increase breast cancer risk in some high-risk women at high risk for breast cancer, particularly women younger than 30 years of age, should weigh the benefits of screening mammography against the potential risk from low-dose radiation exposure. Now, earlier, it was thought that yearly mammography would help reduce the incidence or reduce, we'll be able to identify the disease much early. Whereas exposure to radiation itself was known to increase the rate or the incidence of cancer. And so now the question arises, is there an alternative? Do ultrasound and MRI have a role in screening for breast cancer? I've already told you that these two tests are not available easily, not transportable, and you've got to go to the center which has these centers, and these centers are available only in a few places world over, and the results are almost the same as what you get on thermal imaging. Let me tell you. Now, this is one very important thing that thermolytics has done for us, and that is classifying the hormone receptors and identifying the possibility of cancer, development of cancer in an individual. So the vascularity is graded based on the number of hormone receptors that are there in the individual breast. And based on this, if a cancer develops in, let's say, grade 4 type of breast, the progression will be very fast. Whereas if it develops in a grade 1, the progression of the disease will be rather slow. This is the difference that thermolytics has been able to give us. Now, facts about cancer in India. Breast cancer is seen more in cities, relatively less common in rural areas. Breast cancer accounts for 25 to 32% of female cancers in cities across India. Only about 60% of the women who are treated for breast cancer in India survive, at least for 5 years post-treatment. 86 in the US. Majority of breast cancer patients in India present for treatment at stage 3 or 4, and that's why the outcome is poor. Is an alternative breast screening program necessary for India? Can it become a model for the rest of the world? Yes, thermolytics is playing a very important role today. Let me tell you something that I have gone through in this, and the role of the AIIMA has been in this, and that is, earlier I had an accuracy of about 85 to 86%, both with thermal imaging and ultrasound. Whereas with thermolytics alone, the accuracy has gone up to about 92%. That is a large difference between us directly visualizing the image and an artificial intelligence computer visualizing the image. That is the advantage thermolytics has given us. Now let's see a few of the images. Now this is a normal lady. This is a lady with cancer. Now thermolytics is, artificial intelligence is playing a very important role in quite a number of aspects of healthcare. It's useful in data management, trying to identify asymmetrical patterns, socio-thermal distribution, vascularity analysis, hotspot boundaries, hotspot characteristics. These are things which we are very difficult to directly visualize. Whereas with artificial intelligence, all these aspects are precisely identified, and that helps us in arriving at a better diagnosis. Now, artificial intelligence in healthcare has got a lot of areas where it's useful, and it has become a transformational force in healthcare, and has been, especially in imaging field, it plays a very, very important role. In direct thermal imaging, only a visual impression is by a specialist is resorted to. Machine learning, I told you just now, gives you a much more detailed information about the area that we are visualizing. Now, these are 5 views that we generally take of a patient, right? And this tells us whether the patient is normal or abnormal. Here are some of the abnormalities. Now, what are the conditions where thermal temperature increases? One is trauma, the other is inflammation, and third is malignancy. There are 3 conditions where the temperature in focal range in temperature can occur. These are traumatic injuries, inflammatory condition in breast. Now let's see some of the abnormalities. 30-year-old female, pain and lump in the breast, 2 children, carcinoma in situ. These are all the various. This is the earliest you can identify. 39-year-old patient with early malignancy. See that small lesion there, which is very difficult to identify on mammography or any other examination. These are all established cases of carcinoma of breast. This is another case of focal lesion, and you can see the increased blood flow to that particular area. So now, what are the ideal methods? What is recommended today as a screening protocol? Self-breast examination, then clinical breast examination, screening mammogram, thermogram, and clinical breast examination. So thermogram can start from age 20 right up to 70, whereas screening mammogram usually after 40 years. Now, what are the other areas where thermal imaging plays a very important role? Focal inflammations, fibromyositis, ankle injuries, knee joint diseases, and it's very useful, especially in diabetic situations where you have peripheral neuropathy and peripheral vascular changes, very beautifully identified on thermal images. You can see the foot and the hands being identified here. Well, with that, I think I've, in a nutshell, tried to show you what thermal imaging can do for all of us. Thank you very much. If there are any questions to ask, I will be able to answer them.
Thank you. Thank you very much, Dr. Ramprakash, sir. I really appreciate that you were able to log in from Ghana, and at this age you were able to deliver your insights, being a radiologist as well as taking thermal imaging first time in India. So there is a question from Azman Brahim. From your experience, what has been the most common range in degrees Celsius detected between healthy and affected tissue? That's the question. Azman is asking.
Yes.
You want to come live and ask, you can unmute yourself, Azman. We have a question from one we have time for one more question. So please type in the question. Yeah, maybe you can answer that, sir. Yeah.
Let me tell you, it depends on the age factor also. If you are a younger age patient, the temperature difference has got to be more. For an older patient, the temperature difference has got to be less. In a young patient, we always look for temperature increases above 2 degrees centigrade, focal raise of about 2 degrees centigrade. But in the older patients, anything above 1.8 degrees is something that's significant. So this is how we look at the temperature changes, and this is what helps us to identify the abnormalities.
Okay, thank you. So if there's no other question, one small question from me, sir. Earlier, I think long ago, almost 10 years ago, when you started, you had the Meditherm, which was possibly like a lower resolution. So do you see that, if thermal cameras are becoming better and better, the ability to detect abnormalities in the tissues will become better in terms of higher resolution, higher sensitivity, thermal sensitivity, etc., both?
Unquestionably. As I told you, your work has done a big job for me as far as screening is concerned. I only hope the world accepts this, and it's already accepted. I think we have about 80 to 100 centers in America now.
No, India, we have 200 centers, and we are in
India,
20 countries, actually. 20
yes,
countries are using this. Yeah,
I've been seeing the images now. Compared to my images, the present day images are far, far superior and far better. That's the improvement that I see now.
Okay. So there are some more questions. Is there sensitivity specific data available compared with mammogram? Yes, Ashok, obviously this depends on the type of AI we are using. If you're asking thermalytics, it is listed on AIIMA website, the sensitivity specific data. We can't have a generic sensitivity specificity. It will be based on the AI that is being used. And throughout the rest of the sessions, you will see researchers talking about their algorithm and how well the sensitivity has been. So for now, we will pause the questions. I know there's one question from Ronak on how much initial cooling standardization affects the result. So this will be the last question. Sir, any comments on cooling or preparation of the patient that you want to share based on your insight? Of course, now we try to bring in ML into it also, but before that, what was your doing cooling?
We should have a room which has got a temperature of anywhere between 20 to 25 to 28 degrees centigrade, and 10 minutes cooling will be adequate for the patient, and then you can start the procedure.
Yeah, and for those of you who are new to NIRAMI, we have developed even AI algorithms to figure out whether the cooling is sufficient or not. So, once again, let us thank Dr. Ramprakash sir for his excellent view of thermal imaging and thermal imaging plus AI as a radiologist, as a senior radiologist. Thank you very much, Doctor, for taking out time to educate us and give a broad overview of thermal imaging, breast cancer scenario screening, etc. And then finally, how AI can really help a doctor, a senior doctor like you as well. Thank you so much, Doctor. Really appreciate your time.
Thank you.